With so much bad employment news, Republicans are making a new push to reopen the economy. For them, it's not just a financial calculation. It may be a political one. If the economy doesn't bounce back before the election, there are concerns the party and President Trump could face defeat. But what are the risks of their strategy? To get her take on the story, we're joined by Kenesha Grant. She's a professor of American politics at Howard University. And Howard University, a lovely place to visit if you haven't been. And they're having, as I understand it, their virtual graduation ceremony today. So congratulations to all the students at Howard. Let's talk about politics and President Trump and the Republican strategy to pivot from public health, it looks like, to the economy. What do you make of that?
I think that's the best bet for Donald Trump. The economy is not doing well. It's at historic levels of distress. And I think that he probably understands this as something that he does not want to talk about, understands it as something that might affect the way that folks vote in November. And so will do all that he can to talk about anything else besides that.
Let's talk about, though, he has made it his brand, the economy. How vital is it that that economy has to recover? And we're only months away now from when Americans go to the polls.
I think there are a couple ways to think about this. On one hand, it seems like Donald Trump can do no wrong in the eyes of some voters. And so it might be the case that it doesn't matter what the economy does or what the coronavirus does. There are going to be some people in the American electorate who support him regardless. The other more traditional way to think about it is that voters usually punish presidents who are putting them through a tough economy. If the economy is bad in November, so the traditional literature suggests, the American electorate will vote against that president. So if that holds up, if that's true, given that we are in one of the worst states that we have ever been in, we should expect that the American electorate would support a Democrat in November.
So that's the economy side of the equation. What if, as some have suggested, the risk is run by opening too early and you get a second spike? At what point do people start blaming the president not for the economy necessarily, but for the lives of those friends and family who they may see dying around them?
I think that's a really tricky question. So to this point, we've been hearing about the epicenter of the coronavirus outbreak being in New York City. And I think for many Americans, New York City is a world away from them. And so they don't really have the same kind of connection to that. But as the virus moves into rural communities and even to the White House, I think different groups of people will be forced to reckon with the coronavirus and what it means to be sick from it and what it means to try to get to a doctor or not have access to health care. And so for those reasons, I think it might be possible for even those diehard Trump supporters to have to rethink their positions. But I think it's also possible that the president and the Republican Party will work to put some spin on this to suggest that all the things that they experience, even when the coronavirus is wreaking havoc in their communities, is not the president's fault. And if they can be successful in blaming this on China or blaming it on Democrats or blaming it on a faulty system in our healthcare and suggesting that none of those things are connected to the president, then it might be the case that those diehard supporters on the Republican side and some folks kind of in the center on the Republican side might still support the president in November, even given all this mess.
Kenesha, you mentioned the word health care. Is there a chance that with all this concern and with many seeing a disparity in the availability of health care around the United States, that health care could once again become a primary election issue going forward?
I certainly expect that it will. I think that for the Democrats, they don't have a choice but to talk about health care as an important issue, to talk about not universal health care, because the presumptive nominee has suggested over and over again that he's not interested in that, but something very close to that. I don't know how they could possibly suggest to the American public that they understand all the problems that happened with coronavirus and not talk very clearly and openly about access to health care for all people and not just people with insurance. So I expect that certainly to be on the Democratic ticket. For the Republicans, I think it's a little less clear. I think they will use language that suggests that they want to beef up the healthcare system, but I think it won't look anything like the Democratic response. I can imagine they'll be talking about problems, talking about maybe putting a little bit more healthcare in rural areas, but I can't imagine that they will be talking about extending access to healthcare in terms that come close to eliminating insurance or other kinds of barriers, financial barriers to healthcare.
So much of all of this is unprecedented, no question about that. But we've seen the president, of course, he has access to cameras and the full national media whenever he chooses. Joe Biden is in his basement. What do the Democrats have to do, and yet seems to be doing reasonably well in the polls, so what do the Democrats have to do to fight their fight and to continue to try to win voters over?
I think the Democrats have to get very creative. Just this past week, or I'm not sure if it's supposed to happen next week, Joe Biden is taking a trip to Florida. And so when I heard about this trip to Florida, I thought it was insane because nobody's moving right now. But it's a virtual trip to Florida that he's taking, where he's going to visit a congressional district with one of his allies in the Congress. And so I think they're going to have to continue to do those kinds of things. They're going to have to meet American voters where they are. And so for some of that means that they're going to meet us on our devices. They're going to meet us on our laptops, on our phones. But for others of us, they might have to meet us at work. There are essential workers still on the front lines in hospitals and grocery stores and throughout various parts of our society. And so I think they're going to have to figure out how to do that. And they need to be laser focused on a mail-in ballot initiative for the fall, I think. I think if they don't start thinking about how they will deal with getting votes in a manner that's not in person, is going to cost them much more than it's going to cost Republicans.
Kenesha Grant, thank you as always. Pleasure having you on.
So good to be with you today, John.
Absolutely. And congrats to all those great kids at Howard. Kenesha Grant.
Yes, HU, you know.
Professor of American Politics at Howard University in Washington, D.C.